what is essential to make somebody a good chiro? We require students take a module on interprofessional collaboration, not just more integrated, but also, I have to say, more respected, particularly by our other healthcare providers. Not only are the students learning, but we're learning.
The first thing we want to explore is, what do you think makes for a good chiropractor?
That's a really good question, because we hear that from our students quite a bit, particularly as they progress. What's going to make me a good chiropractor? Well, how am I going to be good with patients or in the clinic? As an educator, the foundational thing is, what's your knowledge base? That's certainly a significant component. But one of the things we've been emphasizing, one of the things we really stress in every module these students have, are things such as communication. You need to be able to talk to patients. I'll give you an example. My last anatomy final, I lecture in anatomy, and one of the questions I asked was, a patient comes in with a knee problem. How would you explain that to the patient in lay language, as opposed to using technical language, which they found that to be very challenging. So the emphasis in that regard is, how do you deal with a patient in a way that patient can understand, so that they really have a good knowledge of what you're doing for them. As well, obviously empathy needs to be part of this. One of the other things I stress is being open. I'm very strong on transparency, both from my standpoint with my students and as a practitioner. Patients need to know. Along with that, that willingness to learn. We all have our CPD requirements, but I know many people do it just because it's an obligation, not because they're excited by the prospect. At least I hope there's not many like that who aren't excited. I also think being flexible and adaptable is really important. Like what's happening now. We have to really move into a situation, really it's the vast unknown. And how are we going to deal with that? For me, at my end as an educator, it's been quite challenging, moving into this area of high tech, which is something I'm admittedly not the best at. But I think it's also important in terms of patient care, because again, you don't know what's going to walk in the door. So those are really important components. The other aspect, and again, we do talk about this, particularly as students progress a little further along, is collaboration. I think, as you know, we require students take a module on interprofessional collaboration. And I think that's a big step forward.
Yeah. Well, one of the great advantages, of course, of the sort of course that you've got at London South Bank is that they're learning the early stages of the course with students from other disciplines.
Yes.
So they're not isolated in the same way.
Which is really, I have to say, and something I was going to bring up later, asking about, was that not only are the students learning, but we're learning.
Well, and it's a bit of a cliche, but if you don't learn something new every day, what's the point of living? So, I think there's a lot in that. So taking that theme a bit further, what do you think the future holds for chiropractic education generally, both in the UK and internationally?
Okay, well, I think this is actually really something I've been thinking about a lot lately, even before this. Where are we going? Because our program, as you know, we're entering into our third year. We just finished our second year. And as I said earlier, we're learning, because we certainly are learning what is needed, what isn't needed. One of the questions I ask myself consistently is, what is essential to make somebody a good chiro, versus what is information that would be good to have, but may not be as important. And that's really, and I say that guardedly. One of my, for example, I'll give an example, in radiology. When I was a student, I'm sure when you were a student, X-ray was the big thing. That's what we all learned X-ray, how to read them, how to take them. That's changed. We know that. X-ray is still important, but we have MRI, we have CT, we have ultrasound. And given the changes in the university, I can't speak quite so much for institutions that are not university-based. And the amount we have with students, there's some things we have to kind of weigh, what's essential and what isn't, what's changing in the profession. One of the things we've decided is we're going to spend much more time looking at these other types of imaging and less dealing with things such as positioning. Mostly because, first of all, time's an issue. Plus, we know that, at least where we are, we have our huge radiology department, and we can rely on that. So that's one of the things that we're kind of balancing or trying to balance: what's essential, what's less essential. Again, not that the knowledge doesn't have to be there, but where are we going to fit it in if we can? So that's an important part. Now, the university itself has been really quite supportive. They've been very helpful. They're willing. My colleagues there have gone beyond, not my Chiro staff, but the other colleagues gone beyond in helping us. So where's education going to go? I think we're going to broaden. I think we're going to become more integrated across the board. I think that our students will become much more evidence-based practitioners. And we know that that's the direction we're going in. And I think that that's part of that education process. So
that's good. So looking at London South Bank, what do you think of the strengths? What does your institution bring to the table which is perhaps different, or what do you think you excel at? What are the things that are really special about the experience your students get?
There are a couple things. Number one, just to toot my own horn a little bit, is the program. We are, as I said, I'm strong on transparency. And I've said this to our students from day one. Any issues, any problems, you come to us and we'll do the same. And they have had direct input into the program in terms of not necessarily what, because obviously they're inexperienced, but more closer to how it's taught, what works best for them. Students today are very different. When I started teaching full-time about 15 years ago, but I've been teaching for, again, 30 years, and students are very different today. They're much more tuned in to what's going on, much more knowledgeable in many areas, particularly in how they learn. So the university has been very supportive of that. As far as other things, and like I said, in many ways, they've been very helpful. Like this, and I think one of the big issues is interprofessional collaboration. That starts in year one. They continues in year two, at which point by year three, they're starting to branch off into their own area. But at the same time, they now have connections, not just to other students, but to other professionals outside. So it really is that's a very strong point for us.
Your institution was the first one to look at the concept of placements for students in existing clinics.
Yes.
That was a very innovative idea. How do you think it's panning out? How do you think it's working? Great,
in a word. On both sides, our students come back very excited. They feel, and I've heard this numerous times, they actually have a chance to see on the inside where they're going with their education, what it's going to be like, what it means to them, what it will mean to them. And I've had nothing but positive reviews from our clinicians, our placement providers. They're also very excited by the prospect of having people who are not yet registered, but who can come and watch and learn and discuss things with them. And again, that's a two-way street, because particularly clinicians who've been out for a few years, they get to talk to students who are learning cutting edge. So that's new for them. And at the same time, the students get to watch how practice works. So it's been a really successful.
Did you find recruiting the practices to that program was relatively easy, or did you find you had to do a bit of persuading?
Well, for the most part, it was easy. There were a couple practices that, right now we have 16 practices that we can place at. I've approached maybe 20 altogether. So we've had a couple for varying reasons that either couldn't or wouldn't. But overall, people are very excited by the prospect. And as a matter of fact, they keep saying, well, when can we get more? So
Oh, that's great, isn't it? So on that basis, where do you think the profession is going to be globally in 10 years? I mean, we're hoping for growth in numbers, of course, but it's about the positioning of chiropractic within the healthcare scheme. What do you think is our potential?
I think that, and it's going to depend country by country because they're all, as you know, somewhat different. But I think overall, the profession will become more integrated. We will become more part of the norm rather than the outside. When I first started practicing, we were very much on the outside. This was in the U.S. and over the years, I mean, now I know in the States, they have chiropractors at the veterans hospitals and things of that nature. I spent time at the National Institutes of Health, which was unheard of at the time. I was also a director of medicine at a cancer clinic. Now, I'm not a medic, but those changes are slowly coming through that are allowing us as a profession to progress and to become not just more integrated, but also, I have to say, more respected, particularly by our other healthcare providers. And that's a good
So,
point.
and that points towards diversity of career experience, so that it's not just going into clinical practice now, but the opportunities to go and do other things related to healthcare. So what do you consider, if you look at the sort of outcome for your students, in other words, the opportunities that they have, what do you think are the best tools for recruiting students? And that's not just about numbers, which of course are important, but it's also about things like diversity. And you're in a very diverse community in central London. But
and just to comment on the diversity of our student base, I was looking at this a while ago because before this issue has come up internationally, but right now we have two full years. I don't know what's coming in September, although the numbers are very good. But we are divided 50-50 male-female, and just about the same in terms of minorities. We have a very large group of minority students who they're going to be part of the profession, and I'm really pleased about that. And I think that will do a couple of things for the profession. One is it'll make it better known throughout those communities where we have not had a particularly open view. People don't know. So I think just the types of students we have coming in will make a change in that regard. And one of the other big issues, again, practicing in the States, I practiced in a couple other, in Spain and in Holland, and it's always the same issue. People don't know. I think getting into schools would be, before university would be really useful. Probably letting the counselors who deal with this know, because most of them we're not even on their radar. So that's a big issue, I think, for the profession, is letting us become part of that. Yeah, so
that careers advice right at the beginning when they're secondary school students still. Yeah. And it'll be interesting to see how I've noticed when coming to talk to your students, the diversity in the room is very impressive. And it will be interesting to see whether that is now duplicated in other cities where universities are setting up.
I will say, sorry, I didn't interrupt, but I will say, I think part of that is because we're in London, which, as you know, is an incredibly diverse city. But it's not, it's not the only program. So hopefully that we'll see that same thing happen elsewhere.
Do you think there might be room for another program in London in the future?
Well, I'm biased, I will say that.
Yeah.
But I suspect in the future, probably. Look at one of our colleagues, our medical schools. How many are in London? There are several.
Exactly.
And there's talk of others. So as the profession grows, there'll be more need.
So perhaps, sorry to interrupt, but perhaps as more medical schools develop, there might be an opportunity to develop a chiropractic program in a new medical.
I actually hope that happens, because I think that would be a good direction for everybody, both
Yeah.
the chiros and the medics, because again, one of the things I used to come up against, particularly when I was in the working in the oncology clinic, was that the medics were very skeptical because they didn't understand where we came from or our education. And that was an ongoing thing. That changed over time as we got to know one another.
Yeah.
So,
And that is certainly something which I've noticed in my career. When I started, there were very few chiropractors in the UK, and I certainly noticed a change in the way the medical profession perceive us as we've got more visible and as what we can do has become more understood.
yeah.
I think there was a degree of worry about these. What are these guys doing? You know, here they are doing something to our patients, and we don't know what it is, sort of thing.
That was very prominent when I first went into practice for several years in practice.
Yeah.
You know.
So if we're going now, that's covered the main themes I wanted to go over, but there's the last point, which is really to give you a chance to explore some of the things which are, are pertinent to you. So do you have any specific issues that you'd like to explore now about the profession and this, where it sits?
You know, it's interesting because specific, other than what I've spoken about, no, because I feel like I have that opportunity with what I'm doing, in that I'm educating or help educating the chiropractors of the future, and it gives me a chance to, dare I say, to mold them, to express my ideas and to have those discussions with people who will be hopefully the leaders in the profession in the future. So, and it also helps me change my views because, again, in certain areas, they're certainly way ahead of me.
Yeah. Well, it's a great privilege for you. It's also a great responsibility, isn't it? I mean, that's something which, they always say that privilege comes with responsibility, you know, but it certainly does in the case of educating the next generation.
Absolutely, it is. I find it very exciting. I'm enjoying it a great deal.
Yeah.
So.
Well, I get your enthusiasm from just talking to you, and it's been very good. Thank you very much, Mark. Now, I'm also, I should at the beginning have asked you to introduce yourself and to say where you came from. So because I forgot to do that, I'm going to give a little bit of a break now for a second or two, and then I'm going to ask you that question. So,
Okay.
Mark, thank you very much for agreeing to do this conversation this morning. I wonder if you could just give us a brief background as to how you came into the profession and how you have arrived at your current position.
Okay. How I came into the profession was probably the way a lot of people did. I had a family member who was injured. I at the time knew, this goes back a few years, who had been injured. She went to a chiropractor, and I saw amazing results very quickly. This is after having been to her medic and her physio, and it got me thinking. At that time, I was working in publishing. I was in science and technical publishing, and I was ready for a change. I looked into the profession. Well, there's the history. Since then, I've been very fortunate in. I've practiced in 4 countries, which it was also very enlightening because there are so many similarities between what we do as a profession, even amongst cultures that are different. And I've also been very fortunate in some of my other experiences. I was the director of medicine at a cancer clinic, which I did for a decade before I moved to Europe. And that was very, very enlightening. It opened a lot of doors, both professionally and for me, in terms of my interests and my research. I spent a little bit of time at the National Institutes of Health, which was also quite enlightening because they are a unique organization. Patients are referred to them by their medical doctor. They only take cases that are highly unusual. But the way the team, I was in the pain and palliative care division, the way that team is run is everybody as a group sits together with an equal voice, whether it's the head oncologist, whether it's the pain management people, whether it's they had music therapists and they had hospital chaplains, and you sat at that table with an equal voice. And that really taught me a lot about that, about collaboration. So I came to the UK about, I guess, about 15 years ago, close to it. I was teaching at the University of South Wales. And just a little over 2 years ago, I started at London South Bank University as the course leader for the new program, which we've been building and developing since.
Well, and I wish you all the best for the future. I am watching with great interest and enthusiasm the product of your labors. So thank you very much indeed, Mark.